Hi, my name is Claudia. I'm a registered physiotherapist in Proactive. I work in the East location in Danforth, and today I want to talk about Bladder and Bowel Diary. You may experience issues with your bladder, but not every person with urgency or every person with incontinence is due to the same reasons. We want to know as much as we know as we can about you. And one of the things that allow us to know better about your habits is having a diary. These diaries are done for 48 hours and show us what we need to change and what are the recommendations that we need to give for your specific case. What you're going to do is grab a blank paper. You're going to time from the minute that you wake up all the way 24 hours. You're going to go and mark in one column from the AM to the PM. In the other column, the length of your pee. You may sit in the toilet for a minute, but we want to know how long is the pee. So you may go shh, and that may be 3 seconds, but that is not the time that sometimes we think that we were in the washroom. So the stream, the void is what we want. So you may mark 6 a.m. I had a 20 seconds, and you take note of the seconds. Don't worry that you may count faster or slower than another person, but we want to know the measure for yourself. And you later can tell us if that stream was really strong, weak, or normal. This is the same as when you open the tap, the water, and you may hear the stream being like a really small stream or really strong. And that's the information that you want to give us with the diary. Then you're gonna mark the amount of fluid that you're drinking. For these, you're gonna try to be as objective as possible. Measure the amount of liquid that you're drinking. You can tell me that you have a big bottle, but is that 16 ounces? Is that big bottle for you 10 ounces? For someone can be a gallon. So let's be as specific as possible. Measure everything that you're gonna ingest that is liquid at room temperature, even ice cream, the milk in your cereal, tea, soup, anything. So let's say 7 a.m. I had a bowl of cereal with 200 mLs of milk. Did I had almond milk? Did I had 2% milk? Let's take note of that and let's see later if that affected your bladder or bowel function. Then you're going to take another column and you're going to mark the amount of fiber that you're taking. So let's say that in the morning you had this same cereal, you have all the information of everything that we're drinking. Let's focus also on the eating. So let's say that this cereal was 10 grams of fiber. Then maybe at lunch you had some snacks, and those included almonds. So we can always Google things that don't have a label and say, for example, I ate 10 almonds. How many grams of fiber is there? And then I had a piece of cheese. Go back in the label. Maybe you were in a restaurant. Just estimate the amount. It's nothing that it needs to be so strict that you need to measure in grams, weight your food or anything like that. Make it easier. It's just an overview of what everything looks like for you. Then we're going to take a look of the bowel movement. So another column, we're going to mark when we're having these bowel movements. Let's say that at 6 you went pee and you had a bowel movement. Let's say that later at noon you have another bowel movement. You can also make a note if they were soft, if they were hard. All of these small notes needs to make sense to you. It needs to make something that relate to your issues. If you have a perfect bowel movement, you don't need to make so many notes. And then we're gonna take another column to mark if there's any leaks. These leaks can be gas, leaning up from the chair, passing gas without control, laughing, passing gas without control. It can also be stool. So you put your underwear after you had your bowel movement and you notice later a little bit of soil in your underwear. Take a note. I had a little bit of stool incontinence. And if you had a run and you were running and you noticed, oh, something happened, it didn't make me feel uncomfortable, change underwear, but there was a drop, you still mark that drop. It could be always an episode that makes you change clothes, but it could be something that you notice that it happens, it doesn't bother me. We also want to know those. So let's say you run at 7 p.m. and you had like a sensation of something happening. You can take notes of that as well if it's pertinent to your case. With all of this information, we're going to be able to know frequency. If this is happening in the AM, PM, is this happening related to a meal, related to an activity? Is this something that we need to change with certain techniques and strategies that we can give you to modify these symptoms? There's so much information that we can get from you, and all of this information allows us to give you a better treatment and be more efficient in terms of recovery. If you have any questions, feel free to reach out. Thank you.